Good morning, everyone, and welcome to Representative Chrissy Houlihan's second coronavirus telephone town hall. I want to thank you all for being with us this morning. My name is Connor, and I'm Representative Houlihan's Communications Director. We're going to get started in a few moments. I just want to let everyone know that if you have a question at any point throughout the town hall, please press *3 on your phones. At that point, you will be transferred to one of our staffers, and they will transcribe your question and then put you in the queue. So again, if you have a question, that is *3. I'm just going to take a moment for all our Spanish speakers on the line as well. Buenos días y bienvenidos a nuestra conversación acerca del coronavirus. Si ustedes recibieron esta llamada, es porque ustedes viven en el sexto distrito de Pensilvania y la congresista Houlihan les representa en la Cámara de Representantes. Porque solo tenemos una hora, no podemos traducir el discurso. Así que les recomendamos que visiten el sitio web de la congresista Houlihan en Houlihan, su apellido, .house.gov. Houlihan, su apellido, .house.gov. Después hagan clic en el botón que dice coronavirus en español y van a encontrar una página con gráficos y texto. Para ver los registros totalmente en español, tienen que desplazarse hacia abajo. Como recordatorio, tenemos hispanohablantes en cada oficina, así que no duden en llamarnos en Reading a 610-295-0815 o Westchester a 610-883-5050. Muchas gracias. And with that, I would like to introduce Representative Chrissy Houlihan.
Thank you, everyone, and thank you, Connor. Thank you all for joining us this morning. This is our second coronavirus telephone town hall, and my office is very much committed to keeping you up to date with accurate information. I know that there really has been a ton of conflicting information going on, so I wanted to convene this call with local health experts so that members of our community can have access to the best possible information about the smart steps that we all can take to help mitigate the spread of coronavirus. So I'd like to take a moment to discuss the work that we're doing down in Washington regarding the outbreak of coronavirus across the country. Last week, we passed on an overwhelmingly bipartisan basis the Families First Coronavirus Response Act. All 18 members of the Pennsylvania delegation, 9 Democrats and 9 Republicans, voted yes for this bill. It is paramount that we support Pennsylvania's families, workers, and vulnerable populations during this crisis. This emergency package supports our community by providing free testing for coronavirus, establishing an emergency paid leave program, bolstering food assistance programs, defending the unemployed and most vulnerable, supporting our healthcare workers and first responders, and enhancing Medicaid benefits that are available to states. This is certainly not a time for partisan politics or misinformation, and I'm working across party lines to protect our community and to provide everyone with the facts. We must work together to, quote, flatten the curve, and I'll explain what that means a little bit, and mitigate the spread of this virus. I was certainly proud to support this crucial legislation. It is the second in a series of bipartisan legislative packages that we are passing to help aid our country at this trying time. The first bipartisan package, we appropriated $8.3 billion in funds, and this money can only be used to fight the virus and other infectious diseases. This package, the first one, includes $2.2 billion in public health funding for prevention, preparedness, and response. It also provides $950 million to support state and local health agencies in conducting vital public health activities such as lab testing and infection control. It includes more than $3 billion for the development of vaccines, therapeutics, and diagnostics to prevent or to treat the effects of coronavirus. I'd also like to take a moment to comment on the situation in Chester County and in Reading and the Berks County area. At this point in time, Chester County and Berks are in declared states of emergency, and yesterday the city of Reading did as well. This weekend, I joined the governor for a press conference to help launch our initiative to mitigate the spread and flatten the curve here in our community and across the Commonwealth. Yesterday, I joined the mayor of Reading to do the same. As of yesterday, these efforts have spread to the entire Commonwealth of Pennsylvania. As you probably saw, the governor declared that for every county, every school across the state has been closed for the next 2 weeks, and he's recommended the same with all businesses that are non-essential. Flattening the curve is a term that's used to describe taking proactive, protective measures to mitigate or to slow the spread of the virus. In the media, this phrase has been confused somewhat with containing the virus. The containment phase refers to the steps introduced to prevent the virus from spreading for as long as possible. This requires detecting early cases and an attempt to establish who those early cases have been in contact with. At this point in the United States, we are beyond the containment phase, as the virus has spread to nearly every state across the country. Thus, we are in this mitigation phase. The Center for Disease Control and Prevention, or the CDC, names the main goal for employing mitigation strategies as follows: to slow the transmission of disease, and in particular to protect individuals at increased risk for severe illness, including older adults and persons at any age with underlying health conditions, and the healthcare and critical infrastructure workforces. A number of measures are being taken in our community and across this Commonwealth and country to accomplish this, and here are just some. As of yesterday, as I mentioned, all schools across the Commonwealth have closed and will remain so to the end of next week, at which point state leaders will reassess the situation and determine our best course of action. Non-essential businesses are being asked to close or to limit their hours to help community efforts to mitigate the spread of this virus. It is also important and incumbent upon all of us to practice social distancing. Defined by the CDC, social distancing involves avoiding large gatherings. If you have to be around people, try to stay 6 feet between you when possible. This is a very difficult, of course, and trying time, and we're really all called upon right now to be our very best selves. This is about our community as a whole. It is as much about protecting our friends and our neighbors as it is about protecting ourselves. As a former entrepreneur and chief operating officer of a company in Chester County, a global company in Chester County, I really know how hard this is, and I will continue to be there for small businesses. If you are struggling as a small business person, please reach out to me and my team. We are here to help. We actually have a special email address or a special website for this issue. It is pa06.smallbusiness@mail.house.gov. And I will say that again at the end of this so that you have the opportunity to write that down. I helped pass the first coronavirus emergency package, which provides $1 billion in loan subsidies, which would enable small businesses and Small Business Administration to be able to have an estimated of $7 billion in low-interest loans to help small businesses affected by this outbreak. I'd also like to note that while our offices are following CDC guidance and are operating via telework, our phone lines are still open and our work continues, be it around the coronavirus, casework, or answering constituent concerns. In fact, you are being joined by more than almost a dozen members of my team who are teleworking right now for this town hall. In terms of our call today, rather than try to answer all of your questions myself, because I'm certainly not an expert on this topic, I've invited 3 local health experts who will brief us on the coronavirus and the efforts that we're making in our community to protect people. On the line now, we have Dr. Benjamin Abella, attending physician and vice chair to the Department of Emergency Medicine at Penn Medicine. We have Marian Moskowitz, who is our Chester County Commissioner, and we have Dr. Federico Seppa, the Director of Primary Care at La Comunidad Hispana. The structure of this town hall will be as follows. First, Dr. Abella will speak to what we know about the coronavirus on a global scale, what we have seen in the U.S. and in our community, and best practices for protecting yourself. Then, Marian Moskowitz will speak to the efforts in Chester County and what we can be doing in Chester County to keep safe. And of course, this applies to Berks County as well. Then, Dr. Seppa will speak to the efforts being made at LCH, which is a community health center, and how we're working to protect the uninsured and underinsured members of our community. Following these remarks, at around 9 o'clock, we will take your questions. So to ask a question at any point in this call, please remember to press *3. This will transfer you to one of my nearly dozen staff who will take down your question and put you in the queue. Thank you so much. It is now my pleasure to turn it over to Dr. Abella.
Good morning, everyone, and I want to thank Representative Houlihan and her staff for inviting me here today. I'm actually speaking to you live from the emergency department, where I'm soon going to be working with our staff on a variety of things related to the epidemic. So I'm just going to spend a few minutes talking to you about the current state in the world, as well as some important facts about the virus and what you can do. So first, it's important to cover a little bit of our recent history. It seems fairly clear that this virus first started to afflict patients in China, but it is clearly now global. So it's important to keep in mind this is not a Chinese virus. This is a global virus. And there are a number of hard-hit countries, including Spain, Italy, other countries in Asia as well. So it's clearly making a global impact. Now, one of the key points to make about that global impact is there are lessons to be learned. Lessons, especially from South Korea and China, have shown that there are public health interventions that work. There are things we can do to greatly reduce the impact of this epidemic. And that, I think, is a glimmer of good news in all of this. Now, first, a little bit about the virus itself. First, so that we all know what we're talking about, there are a number of terms being used: the coronavirus, COVID-19, SARS-CoV-2. These are all talking about the same thing, and it's important to know a little bit about this virus. It's a virus related to the common cold. So coronaviruses have been around for a long time, and most of us at some point have probably been afflicted by a coronavirus, but not this specific coronavirus. An important thing to know about viruses, and many of you may know this, but I think it's important we're all on the same page, is that viruses are not living things. They're particles with genetic material and proteins. And the reason why it's important to know that is antibiotics do not work for viral infections. Antibiotics work for living infections like bacteria, but they do not work for viruses. So although this is an infection, antibiotics will not treat this virus. It's also important to know that, like other viruses, the immune system can learn and develop immunity. So people who have been infected, the vast majority have recovered, and they've recovered because the immune system has kicked in, just like it has for many of you on this call when you've had the flu or common cold. You get better because the immune system develops its own defense. And it seems pretty clear now that all of these people who have recovered, they have developed antibodies. Now, another important biologic thing to know about this virus is it's spread by close contact and by droplets, for example, in sneezing and coughing. Therefore, some of the ways to prevent it, which we'll turn to shortly, relate to that biology. This is not a sexually transmitted virus. This is not a direct contact with surfaces in large part. This is mostly, not completely, but mostly spread by close contact and droplet spread. Now, an important other fact to know about this virus is that there is a strong age relationship to the severity of illness, as well as a relationship to what we call comorbidities or other illnesses. So if you're older, and we'll just sort of define that loosely right now as over 60, or you have underlying lung or heart conditions like emphysema or asthma or heart failure, this virus is much more dangerous for you. If you're younger and healthy, the vast majority of people who've gotten this virus make full recoveries. So that's important to know as well. And the reason why that's important to know is I want to speak a little bit about what I know many of you are feeling, which is anxiety and fear. And it's important to recognize that this is normal. This is a human response. And in fact, I would be surprised if you weren't feeling anxious or fearful. So that is nothing to be ashamed of. That is a normal response. What's important is to arm yourself with knowledge so that we don't panic. When anxiety turns to panic, people do things that are perhaps dangerous or poor choices. For example, if you are feeling well but worried, it is not a wise choice, perhaps, to go to the emergency room for testing. The current recommendation, if you are feeling well but worried about having the virus, Pennsylvania is currently working very hard to set up ambulatory testing sites, and a number of them are going online in the next few days. But by going to the emergency room, first of all, you expose yourself to people with this illness, and secondly, you may also just jam up the healthcare system further. Now, this is very different, of course, if you're feeling ill, if you're having a fever or shortness of breath or a severe cough, then you want to seek attention. But my point is, stay calm, Anxiety is normal, but don't panic. Now, what are the things you can do? And this will take up the last minute or two of my talking to you this morning. So there are very, very clear public health measures that are proven to work, and proven to work in general and proven to work specifically with this epidemic in China and in Korea and other countries. One is washing hands. We touch our face more than we realize, and we touch other people and other things more than we realize. So washing our hands often is important. And by washing hands, I mean with soap and water and for at least 20 seconds. So this isn't a quick rinse in the water. This is with soap. And the reason why is soap destroys the virus. The virus has a lipid, a little fatty layer, and it is essentially dissolved or disrupted by soap, simple soap and water. So one does not need to spend lots of money on specific disinfectants. If you wash your hands with soap and water, that's what works. Social distancing, of course, many of you have heard this term. What does it mean? It means you really need to avoid crowds, and you need to keep at least 3, some people say 6 feet, as much as possible. Of course, there are many cases where this is impossible, but as much as possible, because this virus clearly spreads by close contact. And the only way to break the cycle and mitigate is to not go to social events, not go to restaurants or bars. Now, of course, this is difficult news because we want to support our businesses. So I recommend takeout. I do recommend supporting our restaurants, but we should minimize being in crowds. We should minimize sporting events and similar things. Now, the other really, really important thing is recognize that people with chronic medical conditions or people who are elderly are at much higher risk. So we need to protect them. What does this mean? This means if you have an unneeded visit planned to, say, an elderly family member, a family reunion where you know people will be there who are immune compromised, don't do it. The elderly and the chronically ill need to be protected. Of course, some contact is unavoidable, and if you must interact with folks who are at risk, it's important to wear a face mask if possible or maintain social distance, have them wash their hands after the visit, and you wash your hands after the visit as well. Another thing important to know is stay healthy, get appropriate sleep, eat well, avoid smoking. It is very clear that smoking and this virus don't do well together. So I know this is a tough message for many of you, but if you are thinking of quitting smoking, this is the time to do it. And if you are thinking about starting smoking, do not. And then it's important, and I'll stop with the last 30 seconds here, some important myths. One important myth is that a vaccine is around the corner. I am afraid to tell you it is not. The most likely time course for a vaccine would be no less than 6 months from now, more likely 6 months to a year. Trials are starting, but viral testing and viral manufacture are a slow process. So there's not a virus coming in the next week or even in the next month. The other myth is that large doses of vitamin C or large doses of zinc, there's no evidence that those help in this virus. I've seen posted, I'm going out to dinner, I'll be fine because I took a lot of vitamin C. That is a myth. There's no scientific reality there. Now, as Representative Houlihan pointed out, and I'll close with this, it's very important to have facts and credible sources. And I've been very proud of our representative and her staff because they've really believed in fact-based policy and speaking truth. And I think we all need to be mindful of that. There's a lot of rumor and a lot of dubious information on the Internet, which is very natural and unavoidable. And in our era of social media, it's especially so. We need to be careful. There will be many claims that this cures the virus or this is what you must do. You should be going to trusted sources like the representatives' offices, like the Centers for Disease Control, like your healthcare provider. Avoid the tweet that says there's some miracle cure for this virus. And I think with that, I'll stop and pass it back to Representative Houlihan. Thank you.
Thank you very much. And at this point, I would love to pass it on to Marian Moskowitz, the Commissioner of Chester County, for comments.
Thank you, and thanks for having this, Congresswoman Houlihan. We appreciate it. I just want to go through the list of some of the things that are available to county residents and also explain exactly what kind of services we are presently offering. So in our health department, we have an awesome staff, and the director is Jeannie Kasner. She's working around the clock with our Department of Emergency Services. We have a great website that gives you all the factual information to the coronavirus, how to keep from spreading, how to try to avoid getting it, toolkits for our businesses and long-term care facilities, etc. The website now, unfortunately, includes information on Chester County's presumed positive cases, which are 6 at the moment. The health department remains a trusted source of information for everyone in the county, and I thank all of them who have been working around the clock for weeks now to ensure the information being given is accurate and timely, and to do everything possible to keep Chester County healthy during this time. Our Department of Community Development and Human Services are coordinating and monitoring additional services. Schools and senior centers providing food boxes to be collected or delivered, and the senior centers are remaining in contact with their at-risk seniors. Meals on Wheels continues to operate. The United Way of Chester County just launched the COVID-19 Response Fund to help nonprofits with the people they serve and with their own stability. Community Warehouse Project is providing mattresses for shelters that are adding capacity for housing. Our shelters are remaining open: Safe Harbor, Good Samaritan, and Atkinson. The county's street outreach team continues to engage with people experiencing homelessness and calling 211 for assistance. The Chester County Food Bank is helping with homeless families sheltered at hotels. And as always, the food bank is ensuring that food continues to be available and provided to all existing distribution sites, and also responding to new needs as they are identified. Our mental health and drug and alcohol treatment providers continue to work with clients through tools such as FaceTime and Skype. Chester County is so lucky with so many nonprofits, faith-based organizations, and individuals and families who find joy in giving, in helping, and in volunteering. Even with the restrictions that coronavirus brings, people are stepping up to help and finding ways to continue much-needed services. Now, for our county government, we are on essential services only until the morning of March 30th. We are one of the county's largest employers with more than 2,400 full and part-time employees. We also provide services to and for the public through many of our departments and our courts. And on any given day, thousands of people may be walking through the doors of county buildings. So we must look after the health of the public and our 2,400 full and part-time employees. Essential services continues. Our 9/11 Center, the prison, the youth center, and Pocopson Home, court services, and support for our vulnerable populations are operating. At the Pocopson Home and the prison, no visitors are allowed at the moment. Prison staff is screened for the coronavirus at the beginning of each shift. We have the technology for a majority of our staff to work remotely, so we can actually continue with more than essential services, but from home. It does mean that our libraries and parks are closed, but we have kept our trails open, though amenities are closed, like the bathrooms. We fully support the governor's aggressive mitigation plans and doing all we can to uphold them while also helping those who are impacted, individuals and families, and our business community. Specifically for the business community, right after this town hall, as Congresswoman Houlihan mentioned, we're holding a town hall gathering for Chester County business community. We're going to update them on guidance and essential services at the county and state level, and importantly, providing information about assistance programs that are available to help businesses navigate through these unprecedented times. The town hall panel includes Congressperson Houlihan, plus representatives from Chester County Chamber, the Economic Development Council, and the Chester County Workforce Development Board. There is still time to register if you like. Go to www.chesco.org for details. Also, on that site, you will see a link for the coronavirus where all of our statistics and information is. It's really good information. I encourage you to go on. Again, we are fully supportive of the governor's non-essential business closing. We think it's imperative that we contain this immediately. I thank you for having me here today.
Thank you, Commissioner Moskowitz. And now I'm going to turn over to Dr. Seppa for a few minutes of comments. He, remember, is from La Comunidad Hispana.
Thank you, Representative Houlihan. So LCH is a federally qualified health center, and for a majority of our members, we are the only access to health care that they have. So our goal in this whole situation is to try to remain open as long as possible and provide as many services possible for our members because they need them. With that said, though, we do have an action plan in place to try and protect not only our staff but our members as well. We've done, our executive team has done a lot of education with the help of, our local health department in conjunction with our local hospitals and as well as some national organizations to develop a plan and best practices, again, to protect staff and members as well. We do have protocols in place to triage people that call in with complaints. We have been doing screening questions for well over 2 weeks now, and we are, again, still trying to offer the same services that we normally do and kind of take on the extra burden of the coronavirus. Luckily, we haven't seen any cases yet, but we are starting to get some more phone calls, and we are starting to, people with mild symptoms, we are trying to stay at home, and we do notify the local health department as instructed. But those in some dire need or that really want to be evaluated, we are seeing them. We do have the appropriate protective equipment for the member and staff, and we have increased our disinfectant cleanings. So again, we feel that we are vital to be present in our community to support them for all their needs. And one of the most important things that we've done is educate staff, and there is fear and there is some misinformation. So we've been very transparent with our staff, giving them multiple updates, and again, talking about our mission and why we're here. And we're here to protect our community, and that's why we need to do all of these things and continue to function. And so far, we have not seen a dip in members coming in for visits, so we're just pushing forward. But we also know we have to be adaptable, and things can change very quickly, and we are ready to do so if necessary. Thank you.
Thank you, Dr. Seppa, and thank you to all our hosts. This is Connor again. We're going to get started with the question and answer portion at this point. So again, please let me know if you have a question, hit *3, and you'll be transferred to one of our screeners. Our first question comes from Jean Hoffman. And Jean, you are on the line.
Thank you, and thank you for having a town hall. This is very informative. My question is, what policies or what safeguards are in place that people who actually need to get the test are going to get the test, and people who do not need the test are going to have those tests actually for people who are symptomatic or who have underlying health concerns? Everything I hear so many people saying, I just want the test, I just want the test. So I just want to make sure that we're not going to overload the system with people who actually do not need to be tested.
Dean, thank you for your question, and I'm going to hand this one over to Commissioner Moskowitz.
So I think the priority right now for everyone in these counties in the state is to test. The priority testing are those with symptoms, symptoms that have gone through screening. In our county health department, we are screening those calls and then referring people, if they have the symptoms that meet the criteria, to their doctors or another healthcare provider for testing. But you're right, we're concerned about that, and we're trying to come up with a plan so that the testing will be done in an orderly fashion. Thank you for the question.
Thank you, Commissioner. Our next question comes from Stephen. And Stephen, you should be on the line.
Good morning. My question concerns the viability of the virus on inanimate objects, how long is it infectious on inanimate hard surfaces, and does ultraviolet light kill the virus?
Thank you, Stephen. I'm going to hand that question to Dr. Abella.
Hello. Yeah, it's a great question. So we believe that this is mostly spread by direct contact and droplets. That said, the virus probably does survive on surfaces to a certain extent. It's not clear how long. So the best I can say is that we should be mindful of avoiding overly touching surfaces and be especially mindful of things like telephones that are shared, of common working surfaces, and we should frequently wipe them off, wash with soap and water, or use bleach disinfectant. Hydrogen peroxide disinfectant also works for this virus. So we should be mindful to clean surfaces. As a related point, we should also be mindful to not, I think it's as an extra measure of precaution, be mindful to not have excessive dangling jewelry, wearing ties. I think at this point I would advise all office workers to avoid ties. This is not a time to bring out your best tie because these things touch people, they fall over counters. Now, is this because they may spread? Honestly, we don't know. But these are just sort of common sense precautions because we do believe the virus does survive to some extent on surfaces. And if you could also repeat the second part of your question.
The virus. Yes,
I'm sorry.
it's ultraviolet light.
Thank you. That's right.
Light.
Yeah, thank you for that. Yes, so ultraviolet light is thought to work, but we haven't tested it for this virus in particular. As healthcare providers, we counsel the public not to experiment with ultraviolet light, though. We certainly use it in healthcare facilities. Here's the problem with ultraviolet light. We know soap and water works. We know bleach works. We know hydrogen peroxide is also effective. While ultraviolet light may work, ultraviolet light, if used improperly, is dangerous. It can damage the eyes and damage vision. It can damage the skin. It can lead to other injuries. And so the notion of having ultraviolet lights, for example, in your house when not properly used or shielded, it also depends on the wavelength. So this is a long way of saying while ultraviolet light probably does work, unless one really knows what one's doing, it's better to stick to soap, water, bleach, hydrogen peroxide, and other disinfectants.
Thank you, Stephen, and thanks, Dr. Bella. Dr. Bella, I wanted to keep you on the line for a minute because we have a number of questions from people asking about whether or not this virus is airborne and can be transmitted via the air, and I would like you to speak to that if you could.
Yeah, certainly, and those are reasonable questions, of course. It is airborne, but when we say airborne, we have to be a little more precise. It is airborne in droplets that are spread in close contact. So it is definitely airborne from sneezes, from coughs, probably even from exhaled breath, because it's pretty clear that there are patients who are infected, barely even know it, don't have much symptoms, and can spread. However, it has been pretty clearly shown that the vast majority of this is from close contact. So it's not we shouldn't think of it as being in the ambient air. That is to say, if you're walking outside, it's not like air pollution, and you're very, very, very unlikely to get it in that fashion. Even if you're in a grocery store, just breathing the air there, this isn't the way it works. It usually, in the vast majority of cases, is very close contact, but it is spread by droplets in the air.
Thank you very much, Dr. Bell. I appreciate that. Our next question is from Lori from Reading. And Lori, you should be on the line now.
Hi, yes. Thank you for having this town hall. I guess my question relates more to the downstream effects of what's going on. And I have a junior in high school, the most important critical year before college, and I just want to know what provisions are going to be made to make up the schools in the event that they run longer than these 2 weeks, 3 weeks, 4 weeks, a month. I've heard 8 weeks. And so the first question is, how are kids going to make up school? And then the second requires the state testing. My son needs to pass certain keystones to graduate, and not having school and these exams I don't even know, were supposed to occur in the spring. So what provisions are going to be made regarding the state testing required for graduation?
Thank you, Lori, for your question. I'm going to hand that over to Representative Houlihan.
Hi, and thank you for your question. I have 3 girls that are in their mid-20s, and I remember very acutely the anxiety of junior year without all of this kind of thing going on. Those questions and answers are being decided as we probably are speaking right now by Pennsylvania state government decision makers and by the education department. And if you have a pencil, and again, I will remind you of this at the end of the call, the best place for us all to access the answers to these questions are at www.education.pa.gov. On that website, the Pennsylvania Department of Education is updating every day the answers to some of those questions in their frequently asked questions area. And as an example, I know that I have a nephew who is also subject to taking some of those tests right now, and some of the standardized tests like SAT and ACT have been delayed. So I think that's probably your best place to access everyday information with all of those frequently asked questions. And again, I will mention that again at the end of this hour, www.education.pa.gov. We also will have links to that same kind of information and many more, like as an example, small business, on our website, which is houlihan.house.gov. And Houlihan is spelled a little bit strangely. It's Houlahan. And by the way, happy St. Patrick's Day.
Thank you, Representative, and thank you, Lori, for your question. Our next question is going to come from Douglasville. Susan, you should be on the line now.
Okay, then. Well, I have a couple. First one is, once you had the virus and you recovered it, can you be reinfected?
Okay, I'm going to hand that question over to Dr. Seppa.
So my understanding is once you're infected, your body builds up immunity to that, and so that's essentially what we're doing when we give people vaccines. We are forcing your body to become immune to the infection. So my understanding, and I don't know if we have much data on this yet, but yes, once you have an infection and you recover, you have immunity to the virus. The virus can always change and adapt. But to that strain of the virus, yes, you should be immune.
Thank you. And Susan, you said you had 2 other questions as well, correct?
Yeah, I'll make it quick. Are the pneumonia shots that the seniors were told to get, is that going to be effective against the virus, this virus?
Dr. Seppa?
No, the pneumonia shot is to prevent is to build immunity for bacterial strains of pneumonia. They are beneficial and preventive, but they will not help with this virus.
Thank you. And Susan, your last question.
Well, this is a little off course, but is there any information coming from Russia? We haven't heard anything about, how it's impacting there, and I just wondered.
Yeah. So Dr. Seppa or Dr. Bella, in terms of medical information from Russia, can either of you speak to that?
I can speak a little bit, although with limited information. It's a really great question. There are a number of websites that are monitoring this situation globally. And one of them, probably the best trusted one, is from Johns Hopkins. There's an excellent website with a dashboard of the world and cases and so forth. Currently, I'm looking at it as we speak. It shows that there are 93 confirmed cases in Russia, 8 recovered and 85 active. Now, probably like many other countries, including the United States, that number is grossly underrepresenting the truth because they probably have limited tests, just like many of us do. So very little information is coming out of Russia, and I've been very active on a global emergency medicine social media networks and Facebook, and there's very limited information coming out of Russia. I suspect they're being afflicted just like everywhere else. This is a limitation of governmental access to media. This is a limitation in testing there, but they are certainly not immune from this.
And this is Chrissy. I'd like to comment a little bit on kind of Russia in general. And this goes to the beginning conversations about seeking truth and making sure that you're being cautious with your information sources. There are some very, very alarming fake news stories out there regarding martial law and those sorts of things that are in the Twitter sphere. They're being passed around via text. Please make sure to check your sources. Please make sure to check with known people who have good information for you, because those are simply rumors, and they may have origins in places like nation states like Russia that are interested in fomenting concern and fear within our population. And we should be very cautious with making sure that we're checking our sources for any kind of information about the virus and also about our government's response to it.
Thank you, Representative. And Dr. Seppa, just a quick follow-up on the last set of questions we had. We have a number of questions about recovery time, and I just was wondering if you could speak to that as well. If someone is diagnosed with the virus, the recovery time.
So recovery time varies widely to do with your baseline medical condition, but people, it's several days to a week of some fever, cough, as well. That gets better as time goes on, and then the thing that tends to linger the most is cough. The fever to go quicker, shortness. Again, there's not on. Again, for most young, a couple of days to about a week, and again, the reason for the 2 weeks of quarantine is because it is on those in that 2 week period.
All right, thank you, sir. The next one is Miss Laura from Devon. Laura, you should be on the line.
You're not on the line.
Good morning. How are you? I wanted to thank you for the. Can you hear me okay?
Yes.
Oh, yes. Thank you. My question was, Congresswoman, please, is if we could facilitate at the county level a way to orchestrate the rushes at the grocery stores. And going back to the 1970s when we had the oil crisis, if we took our last digit of our license plate or our Social Security card and said someone who has an even number 4 might be able to shop Monday, Wednesday, Friday, conversely, an odd number Tuesday, Thursday, Saturday, and Sunday would be a free-for-all day of some kind. So I think if we can make those recommendations, we don't have, the Army Reserve here yet in Pennsylvania, but there would be some relieving of tensions, I think, if we could strategize like that and consider something like that, and it would give great comfort to many, especially those seniors and those people that can't stock up for 2 weeks or a week.
Thank you, Laura, for your question. Commissioner Moskowitz, I'm going to hand that over to you.
Thank you. So we have been in contact with all of our markets, the chains. Everybody has plenty of supplies coming. I think people have just, especially in the beginning, they went and just panicked. I was in a store the other day in Paoli, and I didn't wait very long. The shelves were stocked. Some things were out for sure. I think it will get into a better pattern over the next couple of days when people realize the shipments just keep coming. As a county, there isn't a whole lot we can do to control that at the moment. But we do know that supplies are open, the supply chains are running, and Congresswoman Houlihan may have more information on that, but from our local level, the trucks keep coming. I mean, we're watching it pretty carefully. At this point, I think we'll just stay steady and hope it dies down.
Yeah, and this is Chrissy Houlihan again. I would echo the commissioner's remarks. I understand from the sources that I have that we have at least a 4-month supply chain of the vast majority of all of the goods that we're talking about when we go to the grocery store. And in fact, we hurt that if we shop too much, because then 4 months from now we might have problems. So it's really important that we, control our shopping and control the message. I do know that some stores have been monitoring their hours and providing some for elderly and and limiting some stock. But this is not something that the government at this point in time is able to mandate. And so we want to make sure that we're being responsible with our buying habits.
Thank you all. Just a quick reminder, if you have a question, *3. At our peak right now, we have about 3,600 people on the line, so we will not be able to get to all of the questions being asked today, but I want to be clear that if you have a question that does not get answered during the telephone town hall, a member of the Congresswoman's staff will return you with a call and an answer, okay? Our next question is from Craig in Malvern. Craig, you are on the line.
Yes, hi, how you doing? I was curious if there's going to be any sort of relief for small business owners that currently operate under an SBA loan. We have 2 different restaurants in the area and about 100 employees, and we were able to open them because of the SBA. And but now, we're faced with some pretty large loan/mortgages on them. And we're a little nervous about affording that through this process. And I know the SBA or the government has talked about offering new 0% loans, but adding additional debt is kind of scary, not just to restaurant owners, I'm sure. And we were curious if there might be any way to press the government to consider more of a deferment type of option. I'm sure that would really appeal to a lot of small business owners out there that do have SBA loans. So that's something we were curious about.
Thank you, Craig, for the question. Representative Houlihan, I'm going to give this one over to you.
And thank you, Craig, for your really good question. And in fact, it seems as though we have a lot of similar questions on the line, so we'll only be answering, this one because it represents a lot of general questions. And as the commissioner mentioned, as I roll off of this call, we'll be rolling on to another call, which will be about small businesses in our community to make sure that we have access to resources and available information so people do have good information. So I know that there are, and also importantly for you to know, Craig, I sit on the Small Business Committee in Congress, and as a small business person myself, these kinds of questions are personal. We do have help in the form of 0% interest rate loans. That may not be the right tool for you to use, as you mentioned. There is some information that I would encourage you to look at on my website, houlihan.house.gov. We, Craig, have also set up an exclusive email just for these kinds of questions, pa06.smallbusinesses@mail.house.gov, so that we can make sure that we're processing these questions as we get them. The first the first package that I spoke about that went through the House about a week and a half, 2 weeks ago, did have some, as you mentioned, accommodations for small businesses and increased availability of loans. But your point is an absolutely spot-on one, which is there will be a third package that will come through probably the next time I'm able to convene down in Washington, which sounds like it may be as early as a week and a half from now, that will be on business in general. So the first package was kind of addressing the disease. Largely the second one was addressing individuals through paid leave as well as free testing. The third one will be an even bigger one for industry and for small businesses. And this is a really good idea that you've put forward. And we are actually now being asked for our ideas from our communities to be able to roll into that third package. And so this one I will be certain to push forward to the leadership of the House to suggest that this be something that we take a look at for small business relief. And I really appreciate the work that you do with your restaurant business and understand the anxiety that you have. And again, that email for our people is pa06.smallbusinesses@mail.house.gov.
Thank you, Chrissy, and thank you, Craig, for your question. Next up, we have Dr. Wyckoff from West Grove. Dr. Wyckoff, you should be on the line now.
Good morning. Thank you so much for hosting this call. I really appreciate it. I have a two-part question. The first is specifically about COVID-19 and stigma. I'm seeing a lot of focus on nationality or ethnicity or even appearance of those who live where COVID originated, and we know that can create some prejudice and anger and mistrust. I'm wondering if we can talk a little bit about how to address stigma and stereotyping with COVID-19.
Thank you, Dr. Wyckoff. I'm going to hand this over to both Dr. Abella and Dr. Seppa. So if Dr. Abella, you'd like to speak first, and then Dr. Seppa, any follow-up. Dr. Abella, do we have you on the line still? All right, Dr. Seppa, could you take this one?
Sure. So in our community, we haven't seen that yet. But again, I think to Representative Houlihan's point, there is misinformation. There is a lot of things swirling around out there. Again, the key thing for us as healthcare providers is to give accurate and honest information and to guide people to reputable sources, especially with our staff. We always direct them towards the Chester County Health Department site, which is very good, the Pennsylvania Health Department website, the CDC website, to get this kind of unbiased, most accurate, up-to-date information. I haven't seen that. The one thing I have seen is an increase in anxiety over COVID-19, where we are getting people coming in worried about it, but specifically stigma or that we haven't seen specifically.
And this is Chrissy again. I'd like to comment on that too. I think it's really important that we realize that this is a virus, and that viruses don't care about the color of your skin or your country of origin. They don't care if you're a Democrat or a Republican. They just are a virus. And so we need to make sure that we're dispelling any myth, any malignment of any population at this time. We are genuinely all in this together. We are all humans, all with human DNA, and this virus is indiscriminate in that way.
Thank you both so much. And Dr. Wyckoff, I believe you said you had a second part to your question. Is that true?
I do. It was about the worried but well and really the anxiety that people are experiencing in the county and beyond, and any specific resources y'all can offer specifically around mental health and addressing mental health needs during this time.
Got it. Dr. Seppa, would you like to comment on sort of the mental health aspect as well?
Yeah. So to answer your question, yes, we are seeing that. We are seeing that, especially in our members that do have kind of baseline mental health issues. We do have a behavioral health team that assist us with that. But the other part of that is when I see a patient with, showing some anxiety, is again giving accurate, clear, unbiased information. And again, it's more about the information and getting good information as opposed to what they're hearing, online or on the internet. And again, it's the better informed we are in general, the better informed we can, pass along. And that's not even just to, as I said, that's not even just to patients. That's to staff. That's to our families. That's to our, as a side, my wife constantly texts me new things that are out there. So we have this. We have a debriefing every night in my house to say what's real and what isn't. So I think that's a responsibility of all of us. But in terms of actual mental health coverage, we do provide behavioral health assistance through our behavioral health team. And again, we see them as a critical role in this process and moving forward.
Thank you, Dr. Seppa. Our next question comes from Stacy. It looks like we lost Stacy. All right. Our next question then will come from Dan. I'm sorry, y'all. Let's see. Here's one. Chris from Warwick. Chris, you are on the line. Chris, do we still have you from Warwick? Like we lost Chris. Our next question then, we've got Kristen from Phoenixville. Kristen, you should be on the line now.
Hi, thank you so much for taking my question and for having this town hall this morning. My question is in regard to the healthcare providers. I have read that they are more susceptible of not only contracting the virus, but of developing the severe symptoms. I was hoping that maybe one of the doctors could speak to the validity of that and what we're doing to protect the people on the front lines. Thank you.
Thank you for your question. Dr. Seppa, I'm going to hand that one over to you, sir.
I don't know if healthcare providers are more at risk for severe symptoms, but we are more at risk to get the virus. Why? Because we are in the front lines, because we are seeing members, and because we know that it's spread by droplets, but not all patients are symptomatic, or not all patients are expressing the things that we expect them to express. The key is prevention, and we've been preaching this to our staff. It's the 6 feet distance for staff that don't, that 6 feet different for staff that when you don't have to be on top of the patient. It is people with colds, coughing or sneezing, that they should put a mask on. Hand washing, hand sanitizer, disinfecting the rooms. And if there is someone that we do suspect that has COVID-19, we do have the N95 respirators here in the office, and we've trained the staff how to use it, and proper protective wear, such as gloves and gowns. We haven't had to use any yet, but again, this is, in general, we don't do a good job of this, meaning preventing these kind of things, and these are all the recommendations that we do for flu season, but it shows the importance of it, and I do believe that if we are careful and again we do the right things right way, we can minimize the risk. There's always going to be risk. There's always that's the fear and concern of all of us, but we also as a service community, we know that we take that risk on because our community needs it. But again, if we do all the things properly, we protect both our staff and our patients.
Thank you, Dr. Seppa, and thank you, Kristen, for your question. At this point, we're about to wrap up. I want to make two things clear. One, if you have asked a question and we have not gotten to it yet, you will receive a response within the next 24 to 48 hours from our staff with an answer to your question. Because of the thousands of people on the line, we were not able to even screen every question. So if you were in the queue and you weren't able to talk to a staffer and have your question written down, please, our office is operating at full capacity. You can call the DC office at 202-225-4315 or any of our 3 offices, Washington, Westchester, or Ready, and have your question answered. We also have a page on our website at houlihan.house.gov about the coronavirus and latest updates. With that, I'm going to hand it over back to Representative Houlihan.
Thank you, Connor, and thank you everyone for joining us in this really important conversation. And I certainly want to thank our expert participants for having taken their time in a very busy time to educate us and to join us. As Connor mentioned, our offices in Reading, Westchester, and DC, all of our colleagues are working hard to protect the community and to make sure that we have clear and consistent guidance that we all need to make smart decisions for our own health. I really do want to emphasize that this is not about any one individual, but rather about our community and our community's health as a whole and our community's success as a whole. Only genuinely through a collective and combined concentrated effort and a united front can we mitigate the spread of this virus and protect the most vulnerable, including, as mentioned, those healthcare workers and first responders on the front lines. So this is certainly not a time for panic, as you heard on the call today, but rather a time for a common mission towards what we must all work towards. A reminder of some of the things that we can be doing on the individual level. Please wash your hands with soap and water for at least 20 seconds. Especially after having been in a public place or having blown your nose, coughed, or sneezed. Please try to avoid touching your eyes, nose, and mouth with unwashed hands. Please practice social distancing by keeping about 6 feet between yourself and other people wherever possible. And of course, please stay home if you are sick. I want everyone on this line to know that our office is available to connect you with these resources that we've talked about. I encourage you to check out our website at houlihan.house.gov/services/coronavirus. There you will find updates on the coronavirus resources, including State Department travel warnings. I know there were some questions on the line about travel, and CDC contact information. Thank you, everyone. We will continue to have these calls as necessary. We will try to mix up the times that these calls are offered, but as you can imagine, the opportunity to schedule these calls is quite difficult, with the Congress being everyone trying to reach out to their community and their constituents. It is obviously an honor and a privilege to serve us. I will leave you with a couple of things. One is the CDC mantra, which is prepare, don't panic. Another, which is our own governor's plea to us, which is stay calm, stay safe, and stay home. And the last thing that I would say is that was brought up on the call, as a former chemistry teacher, I'd like to ask that people be careful with whatever it is that they're cleaning with. Please never mix hydrogen peroxide and bleach. That is a very, very toxic combination, and I want to make sure that I say that as much as possible. Thank you so much for being on the line with all of us. We hopefully will never have to schedule another coronavirus call, but we will see you at the next one if necessary. Thank you.